Hospital Sisters Mission Outreach is a medical supply redistribution organization based out of Springfield, Illinois. Working in concert with more than 50 hospitals, clinics, and hospital systems, Mission Outreach promotes equity in healthcare through the provision of life-giving supplies and equipment. Well-documented disparities in healthcare demonstrate stark contrasts between the care, quality of life, and life expectancies of the rich and the poor in the United States. These disparities pale in comparison when viewing the differences between care in the United States and most countries in the developing world. Hospital Sisters Mission Outreach addresses these healthcare disparities through the provision of supplies and equipment to partners in more than 75 countries throughout the developing world. The Hospital Sisters of St. Francis have a long-standing tradition of providing quality and compassionate health care to those in need. With that tradition as the foundation, the sisters desired to make a positive difference amid the stark reality of excess and waste in regard to medical equipment and supplies in the United States. They also recognized the importance in setting a standard of excellence in quality and delivery to those in need in the developing world. Thus began Hospital Sisters Mission Outreach in 2002. From humble beginnings in a garage in Springfield, Illinois, Hospital Sisters Mission Outreach began responding to the sick, poor, and needy through a medical equipment and supply recovery and distribution program, with an additional focus on education and awareness opportunities. That work became our mission, and that mission continues to drive our work 10 years later. All people throughout the world struggle at one time or another, but it is these individuals that must focus all of their energy on keeping body and soul together. Each day presents life and death struggles with hunger, disease, and injury, along with the lack of basic resources for so many in the developing world. Mission Outreach directs all efforts towards areas of the world that have the greatest need for medical equipment and supplies and the least ability to obtain them. Each day, Mission Outreach works to provide life-saving supplies and materials for the least among us, bringing hope to those who suffer. Haiti has the lowest average income of any country in the Western Hemisphere, and the earthquake in January 2010 created a widespread awareness about the needs of the Haitian people that did not previously exist. Even years after the tragedy, continued support is crucial. The 2011 earthquake in Japan served as a reminder that even more affluent countries need assistance in the face of catastrophic events. In the face of crisis in both Haiti and Japan, Mission Outreach was able to provide support. The support Mission Outreach provides is not limited to crisis situations. Individuals in developing countries lack access to basic supplies for medical diagnosis, treatment, and sanitation, leading to severe circumstances of treatable illnesses, the spread of disease, and delayed or impaired healing from traumatic injuries. Clubfoot is a disability routinely corrected at birth in the United States. This malady affects 1 in 735 children born in developing countries, and most cases can be corrected with appropriate treatment or surgery. Unfortunately, children born in developing countries often go without treatment because of deficits in supplies and equipment, and the lack of early treatment has long-term effects. Today, this young man needs to walk to play ball and run errands for his mother. Someday, he will need to walk to provide for his own children. A smile transcends language barriers to engage, encourage, and bring joy. Cleft palate is prevalent in developing countries, and it can be readily corrected with skilled clinicians, surgical equipment, and sanitary supplies for surgery and recovery. This boy has a lot to communicate. He needs his smile today to interact with his playmates, and in the future he will need his smile to encourage his own children and show pride in his work. These needs can be addressed with the right resources, whether it is something as complex as biotechnical equipment, surgical instruments, sterilization machines, or things as simple as surgical drapes and gauze. But many are left to wonder, do adequate resources exist, and are they accessible? This photo captures only a small fraction of the medical equipment and supplies discarded in the United States each year. Landfills like these all across the country contain hundreds of thousands of dollars worth of resources. The healthcare system in the United States discards an estimated $6.5 billion in medical equipment and supplies each year. It is clear that adequate resources exist. Unfortunately, individuals in developing countries are denied access. An effective, economical way to recover and redirect these life-saving resources already exists in mission outreach. In fiscal year 2012, Mission Outreach packed and shipped 50 containers weighing over 1 million pounds and valued at over $6 million to give hope to individuals in need around the world. This work is not done alone. Mission Outreach relies on many different resources working together to achieve our mission. Human resources are integral to the work of Mission Outreach. With training and coordination support, volunteer labor keeps the supply of material resources flowing to those in need. Working with Mission Outreach volunteer coordinators, volunteers sort, prepare, label, and package all materials for container shipments. Mission Outreach coordinated the work of more than 2,000 volunteers in FY 2012. Volunteers provided more than 24,000 hours of service, equating to more than $277,000 in organizational support. Over the years, Mission Outreach has developed an extensive network comprised of healthcare systems, hospitals, and clinics throughout Illinois and Wisconsin as partners in recovery. Staff members within each hospital are trained to recover vital supplies and equipment for Mission Outreach. This recovery meets the need of each healthcare organization to responsibly clear inventory while saving hundreds of thousands of pounds from being discarded in landfills. These partners in recovery also contribute to the organizational sustainability of Mission Outreach by redirecting much of their disposal expense to support the organization. A wide variety of organizations have supported the network by sponsoring containers. Parishes, corporations, family foundations, and individuals from around the world have donated funds to offset the expenses that Mission Outreach incurs to collect, inventory, and prepare a container to places as close as the Dominican Republic and as far as the Philippines. Over the past 10 years, Mission Outreach developed the structure necessary to employ existing material, human, and organizational resources to advance the mission to be a healing presence for the life of the world. The work that began in a cubicle with one employee has grown to a well-coordinated, energetic network of staff, volunteers, healthcare organizations, parishes, foundations, and corporations working together, recovering and redistributing life-saving medical supplies and equipment around the world. With a strong focus on stewardship and a desire to direct resources to those with the greatest need, Mission Outreach has been careful to expand staff and space in proportion to the growth of both the network and the donation of material resources. That cubicle in 2002 has been replaced with a warehouse measuring 23,000 square feet in Springfield to facilitate the processing, storage, and shipment of materials to more than 75 countries worldwide. The work done by Mission Outreach is rewarded when resources are delivered to and used by grateful and deserving individuals from all corners of the globe. This operating room in Haiti was furnished by Mission Outreach partners working across the Midwest. This equipment, previously used to save lives in Chippewa Falls, Wisconsin, Effingham, and Breese, Illinois, is now saving lives in Haiti. A second operating room was also furnished in this facility to accommodate large groups of Cuban doctors visiting Haiti to perform surgery. In the aftermath of the January 12, 2010 earthquake in Haiti, it was immediately evident that needs, such as those experienced by the Haitian people, can only be addressed through collaborative efforts of multiple organizations. A Chicago-based foundation worked with Mission Outreach in the months that followed the earthquake to coordinate the donation of a mobile clinic, and identified a hospital in Port-au-Prince as the recipient. But somehow the mobile clinic needed to make its way to Haiti. Mission Outreach staff took the lead in navigating the logistical maze of delivering such a large item when the port in Port-au-Prince was overwhelmed with relief supplies. Working with the U.S. Navy and their Project Handclasp, the mobile clinic was loaded onto a 321-foot-long naval ship in Jacksonville, Florida. In November 2010, the ship arrived in Haiti, and the new mobile clinic was put to immediate use. The mobile clinic was not the first time Mission Outreach partnered with Project Handclasp. In 2007, the Wilmette, Illinois Fire Department donated an ambulance to firefighters in Buenos Aires, Argentina. Since the ambulance would not fit in a shipping container, Mission Outreach's relationship with the U.S. Navy's Project Handclasp made shipment of the ambulance on the USS Pearl Harbor possible. These partnerships have made it possible for Mission Outreach to begin meeting the medical needs in all parts of the world. Clean, comfortable beds are taken for granted by many in the United States, but they are often a luxury in the developing world. Mission Outreach learned of the poor quality of the beds at the St. Antoine Hospital in Jérémie, Haiti. In an attempt to prevent infection, hospital staff used garbage bags to cover the foam rubber mattresses contaminated by drainage from a previous patient. Mission Outreach was able to send manual hospital beds, linens, and high-quality plasticized mattresses that improved both the hospital's ability to function and the health of its patients. Standing partnerships with foundations, hospitals, and organizations like Project Handclasp aid Mission Outreach in effectively providing medical supplies and equipment in the developing world, but sometimes that isn't enough. Occasionally, Mission Outreach has the opportunity to link individuals who have resources to share with individuals in need. One Central Illinois family became that individual link. After learning of a family in the Philippines who had a child that was struggling with the same life-threatening illness as their youngest daughter, they worked with Mission Outreach to provide the infant's family with the specific supplies and medical care needed. People often ask, "What can I do?" At Hospital Sisters Mission Outreach, there are many ways for an individual to make a difference, ways that fit their interest, availability, and ability to help those in need around the world. Those making a financial investment in Mission Outreach are amazed to learn that their dollars are multiplied when converted to critical supplies and equipment. Investing just $1 yields approximately $6 worth of medical supplies to care for individuals in countries like Bolivia, Kenya, the Ukraine, and South Sudan. Volunteer resources are as essential to our network operations as financial contributions. By investing time through volunteerism, you will join a force of more than 2,800 volunteers who are working every day to get supplies ready for shipment. Hospitals and clinics in the developing world need medical supplies and equipment found in every hospital in the United States, but sometimes it is the everyday items so many people take for granted that make the most impact. Families, parishes, clubs, and civic organizations have contributed by collecting items like adhesive bandages, toothpaste, and soap that make a very real difference in the quality of life and health for so many. The strength of Mission Outreach lies in our story and in our supporters who share it with their supportive family, friends, and organizations. There is joy to be had and joy to give as Mission Outreach and various supporters join together to respond to the needs of people throughout the world. Over the past 10 years, Mission Outreach has found truth in Margaret Mead's words. Never doubt that a group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has.